New cases of COVID-19 appear to be trending downward in Idaho. This is an encouraging sign that we're heading in the right direction. After weeks of seeing 500 cases per day, the state reported just 221 new cases Monday, but deaths remain steady with the statewide total hitting 361. The Idaho Department of Corrections also announced the death of a 64-year-old inmate almost 2 weeks after being in the hospital. It's the second COVID-19 death in Idaho's prisons, but as we've reported many times, health experts say deaths don't necessarily tell the whole story. And as our Nicole Camardo reports, new research suggests that COVID-19 can have long-term effects on those who survive it.
There are a lot of reports out there about long-term symptoms, and there's a lot of work being done now trying to figure out which of these symptoms are specific to COVID and which of them are maybe more reflective of just the severity of illness of people.
Fatigue, weakness, shortness of breath, and even mental fogginess are some of the long-term symptoms people who had COVID-19 might experience. But effects on the heart are most concerning.
There are a lot of complaints of shortness of breath, and we know that there are patients with this virus that have an impact on their heart. There are patients in short term who've had cardiac arrests from coronavirus, and these may be patients who are otherwise not ill.
According to this study from JAMA Cardiology, COVID-19 can severely affect the heart. The study looked at 39 autopsies, and 29 of them showed that COVID-19 was still present in the heart.
They may have fairly modest symptoms. That's been reported nationally, it's been reported internationally, and it's certainly happened here locally as well, where these patients have had a presentation with a cardiac arrest.
Those who have mild symptoms still may experience a long-term effect on their heart, even if they are recovered and feel healthy.
When we talk amongst ourselves as physicians, one of the things we find most concerning is this cardiac issue. Because people can have relatively few symptoms and have evidence of cardiac damage, both on PET imaging study and on these chemical markers, and these can be people who look healthy, feel healthy, and have seemingly recovered completely.
Nicole Camardo, Idaho News 6.
Now we have a link to that full study. If you'd like to learn more, just make sure you search for this story on our website, idahonews6.com.